Thank you very much for inviting me to come and speak today. I wanted to talk about collaborative partnership between patient, hospital and the community and home setting. As you said, my name is Lynne Skrine. I'm the dermatology team lead for Bristol Community Health. I've been working there now for just over 6 years. I don't have any conflicts of interest, but I would like to just point out that Leo, Sanofi and Almirall supported me in attending Congress this year. The aim of my presentation is to give you a short overview of Hailey Hailey, a brief background of my patient, Mrs. W, who I'm going to call, and also to show how a cohesive nursing service across the community and the hospital setting can lead to hospital admission avoidance. Hailey Hailey is also known as familial benign chronic pemphigus. It's a rare hereditary blistering condition, and it was first described by the Hailey brothers in 1939. It's normally found in the skin folds of the groin, the armpits, the neck, and underneath the breasts. And the defect responsible is a DNA error in a gene code called ATP2C1 and found on the chromosome 3q21 to 24. And this chromosome is the gene that plays the part in ensuring that the cells in the epidermis stick together. In Hailey Hailey, the adhesion of the cells is weakened, resulting in separation of the cells, especially in areas of friction, such as the groin and under the arms. And many patients tend to lead a very full life. It normally shows up in the ages of 15 to 40 years of age, and there is no differential comparison between male and female. And if you have already got Hailey Hailey, if you have children, there's 1 in 2 chance that that child will have Hailey Hailey disease. Patients have intermittent flares, and these can be ones that are only a minor nuisance, but they can be quite severe and they can be quite painful as well. The clinical features of Hailey Hailey and also diagnosis of this is, as I said, it is symmetrical. The common places are under the arms, the breast, the groins, in between the buttocks, and around the neck. The lesions tend to become and go. They, as the lesions do get larger, they center clears, leaving a typical ring shape. The family history is taken into consideration, and as I said, if they do have a strong family history, it tends to be that they will probably have Hailey Hailey. They do have a biopsy for diagnostic purposes, and the histology is characteristic between the layers of detached skin cells, and they sort of tend to stand up like a row of tombstones. My patient is Mrs. W, and she is a 71-year-old lady, and she was diagnosed at the age of 29 during her first pregnancy. She only ever had 1 pregnancy, and she has a son who also has 2 children, and as of this moment, none of them have shown any signs of the disease. She's had multiple sclerosis for the past 13 years, and she has a very strong history. Her mother was diagnosed with Hailey Hailey, and there are also around about 30 members of her extended family with the disease. She had previously 1 to 2 admissions per year with very severe flares, and I'm going to show you some photographs of those just in a moment. She lives at home with her husband, and she lives a very full life, and at this precise moment in time, she is somewhere around the Mediterranean on a cruise. I did offer to go and help her with the treatment, but she said that she could manage. These are some of the pictures of when she has flare, and as you can see, they're underneath her breasts and also under her armpits. And these are very red, raw, and very painful. And at times her husband was helping her with some of her treatments, but he found that when it gets this severe, he can't touch it because he says it reminds him of raw steak. And he says that he finds it quite hard to deal with because then his wife is always always crying, and she finds it very painful. She's had quite a lot of treatments in the past, and these are some of the ones that she's tried. She's tried Botox, which she found that when she had it done into her armpits, that a lot of the wetness that was irritating her and the sweating not only went from underneath her armpits, but also from underneath her breasts. But she found that it was quite difficult to have it done, so she only tried it for a few times and stopped. She's also tried a lot of systemic medication, and she's also tried in the past photodynamic therapy, but she found this too painful to be able to continue using it. She's also tried lots of topical therapies, so topical steroid treatments, antimicrobial soap substitutes, and antifungal creams. She's at the moment using a lot of 50-50 liquid paraffin and white soft paraffin, which she tends to use quite a lot of and quite liberally. She was referred to the dermatology team, and I just wanted to give you a little bit of feedback about our dermatology team. It's been going since 2001, where it started off as only a couple of nurses, and our clinical consultants from the secondary care were looking after the community team. The team at the moment now is, it went from 2 clinical nurse specialists. I now have 3 clinical nurse specialists, 2 GPs with specialist interest in dermatology who work 3 sessions per week for me, and we run Monday to Friday, 9 till 5 at various GP surgeries within Bristol. We have really good hospital links. Because I think the hospital set it up in the first place, they still have a vested interest as to how we work and the patients that we see. We're also able to refer straight into the hospital, so it does reduce the wait time that they have. We have very good community links with our community practice nurses, our community district nurses, and also with our health visitors. Mrs. W was referred to us in 2013 after being seen in secondary care, and as I said, she was having 1 to 2 admissions per year. She was also referred to us because she was very low in herself and very depressed with her condition. We went out and saw her. She had a full nurse assessment with one of the clinical nurse specialists at the time, and we also had a joint visit with the community nurses. The community nurses within Bristol are based within the GP practice, so what we tended to do was we would find out where her local GP practice was, have a chat to the nurses and see if we could have one of the nurses there that would come along and see the patient so that we could have some integrated care with them. We gave the nurses in the community a lot of education and also just re-emphasized it with our patient about the use of some of the topical treatments that we were using, and also an overview of Hailey Hailey so that they understood the disease. We supported the nurses in the community with all of this, and then we started working together. Within the community, we have an electronic record for all of our patients, which is shared with our GP practices, as well as with other members within the community teams. So we can see what they're doing, they can read what we're doing, so it makes it a little bit more integrated between each other and means for a better collaboration. We were looking at ways that we could help the patient. So for when she was having a severe flare, we wanted to be able to virtually give her some intensive treatments for over a 2-week period, just to help her over the first initial part of the flare, so that we could then look at how we would look at it later on. We have regular reviews with her at home, and also with the community teams. The treatment that she's having at present is she uses an antimicrobial soap substitute, and she showers with that every single day. She has an ointment emollient, and as I said, at the moment she's using 50-50 liquid paraffin and white soft paraffin, and she's using topical steroids. We've had a few issues with her topical steroids because she doesn't like to start to reduce down when her flare starts to improve. And she feels that if she doesn't carry on using it continually, then her flare, it will re-flare again. So we've had lots of conversations with her, and she's now getting to the point where she's agreeing that perhaps, yes, she will tailor it down and she will wean herself off of it slowly. But she always knows that if it starts to flare back up, she can reintroduce it. We've also been using potassium permanganate soaks, and this is when it gets really wet and weepy. And she manages these quite well on her home, when she's at home on her own. What she has done is she has gone away on her cruise with her potassium permanganate, just in case, because we know that the summer weather and the hot weather tends to make it worse. She's also gone away with lots of dressings that she can put underneath her breasts so that when she does wear her clothes and her fine gowns when she goes out eating on her cruise, that she's able to go and do that, and she finds that it's not too uncomfortable. About 2 weeks ago, about 4 weeks ago, she had quite a bad flare, and last week we did take some re-photographs, and this is her on a fairly good week. As you can see, it's not so red, not so raw, but she is still worried that when she goes on her cruise that it is going to be come back bad. So in summary, she has regular reviews by the hospital between 1 and 2 times a year. She has regular contact with ourselves, which she can do 3 to 6 monthly. We do give her the odd ring every now and again, or we do pop in and see her because she's not far from where one of our GPs holds one of their clinics. Since she's been with us, we've managed to avoid any hospital admission for her Hailey Hailey. Unfortunately, she did go in once with her pneumonia. The team now have a greater understanding of her condition, and we also find that the community nurses do. So what we tend to, with us being able to share the workload with them, if we do find that she has a flare, we're able to call on them, and they are able to give us up a couple of times a week that they can go in and see her, so we're not going in all of the time. We've now built better links with them and also with our patient. Just before she went away, one of the clinical nurses that has been looking after her had this sent up to the administration office, and she bought us a plant because she thought that we'd done such a sterling job, and I just wanted to share it because I thought it was rather sweet of her. So I'd like to say thank you very much, and has anybody got any questions?